Öncelikle ben de teşekkür ederim. Burada bizi dinlemeye geldi.
Thank you very much for coming. In this lovely, it is a great pleasure to meet with all of you in this lovely Antalya. In my presentation, I will be speaking about the cognitive behavioral therapy principles in the treatment of children and adolescents. My smallest patient was 5 years old, and the oldest one was 85 years old. What is CBT? It is a relatively short-term, focused psychotherapy. It is an evidence-based therapy, and it is, in this therapy, we focus on the present, and it enables individuals to learn coping skills. CBT is not a single therapy, it's not a monotherapy, it is the group of therapies. It might be on the cognitive based, it might be a behavioral interventions, mindfulness based CBT. There are many theories that might be present with the CBT. What do we do in CBT in general? Psychoeducation. In psychoeducation, we are trying to explain about the CBT model, and in addition to that, depression, and with regards to anxiety, we convey a general information. After the psychoeducation, what we do is a formulation-based treatment, and we define certain rules, certain goals. And if without setting those goals, you cannot know whether the treatment is going on well or not. So at the first phases, we should define a formulation of treatment so that the patient and the therapist will see the same picture and will have the same understanding about the problem, and as a result, they will understand what we are expecting from that therapy in the short term, mid-term, and long-term possible. And on the midterm, we'll try to understand where we are heading to and what we are desiring to change. And with regards to our long-term plan, we should also understand how we see ourselves in the future. And we are also defining the rationale of the therapy. In the self-monitoring, recognition of the emotions and the thoughts associated with the anxiety and the depression matters. And in the phase of learning skills, we are trying to promote anxiety management and the relaxation techniques. There are some cognitive studies as well. In the cognitive studies, the belief modification or identification and the modification of unhelpful thinking is taking place, and at the latest phase, relapse prevention is our strategy. Is CBT effective? And in the randomized control studies, it has been shown that CBT is quite effective. And in the children's studies, it is shown that the CBT is an effective study. In the studies of Barrett, OCD, depression, generalized anxiety disorders have been evaluated, and for a disorder to be treated in accordance with the NIS, it should be defined that there is an important rationale. For example, in the depression, the first treatment modality is focusing on the mild and moderate depression, and the first treatment model is CBT. If the depression is severe and the CBT is not enough, then CBT plus medication might be implemented. As you can see in this nice guideline, OCD, PTSD, conduct disorders, and many types of pathologies and their treatment model for such disorders might be CBT. What are the differences between the adult CBT treatment and the children CBT treatment? First of all, you should know your client. Because when a 5-year-old kid came to your clinic, you should understand whether the real problem is with the kid or with environment or with their parents. In the adults, of course, the adults define himself to come to the treatment, but you cannot expect the young person to choose to come to therapy on their own. And you should understand the functioning of the young person in context. Of course, with the treatment of the children, the families will be involved as well. Social services might be involved. If the problem is also related to the family, then we should also understand what kind of problems the family have. And we should also understand the different behaviors in the different settings. Another difference that we should take into consideration is that maybe the children might not have those words which can express themselves, and we should understand those underdevelopment. Sometimes a parent session might be needed, because when you are trying to treat a 5-year-old kid, you should also find a way to involve the family. Shared formulation with the therapist and the family is a must. The family should also embrace this treatment, otherwise the treatment cannot really take place. And your focus should be on the kid all the same. If you take into the consideration of the developmental stage of the kid model, you will focus on the behavioral changes in your treatment modality. What are the similarities? CBT is having the same model for both adult and the child. CBT is a model focusing on the symptoms, and the behavioral change is quite important in both groups. I forgot the word. I would like to apologize. How can we understand the engagement and readiness to change? Because sometimes the children might not want to come to the therapy, or the family might force him to come. Since they are not sending the kid to the treatment, sometimes the kid may not want to indeed embrace the responsibility of the treatment, and the kid might think that the problem is somebody else's problems. These are the things that we should take into consideration. These are the different stages of the change: pretemplation, templation, maintenance, relapse, and relapse prevention. You can see that these are the different stages of the treatment. In the pre-contemplation, you are trying to ask to the children, is there anything you would like to change in your life? This is the first phase of the engagement. In the contemplation stage, we are trying to understand what might be the hindrance to this therapy. In the preparation stage, this is the most important part of the therapy. A good assessment is a need, and in the first assessment phase you should also understand it, and in order to understand this stage you should really understand whether this kid wants something to change and what are the factors that can indeed prevent this change, and are there specific goals, and can we really realize this goal. We should understand all of those. Those goals will be quite important for the motivation of the therapy. If you don't define those goals in your therapy, then it will be just a chit-chat. So the roadmap and the goals should be defined, because it will be a roadmap for you, and it is really important whether you are following the right path for your treatment or not. All of those formulation and the goals will enable you to give the right treatment. In the action stage, all of those CBT techniques are being implemented, and the SMART goals are being formed. This is the phase in which the change is taking place. And the maintenance stage, and in the relapse stage, we are trying to understand whether we will be having recurrences in the patients or not. As we continue with the assessment of the family, we have parents. Of course, when we try to treat the adults, we are speaking with an adult, so we know how the problem is starting and what may trigger the problem. And by asking the questions, we can easily understand how the problems are going on. As we do the assessment, we start with the family assessment. What do the family understand, and what are the beliefs of the parents about the problem? What are the coping strategies they use? We should understand all of those, and if there is a need, a developmental assessment might be done. Whether the mother has any depression, post-mortem depression is present or not. And with the questionnaires that we implemented, we can also take a look to the young person's self-reports, which might enable us to complete the assessment. We try to evaluate the behaviors, the friendships and the social relationships, relationship to authority, attendance, attainment and the performance in the school environment, and the relationships with the other people also matters. Last 5 minutes, please. I couldn't use my time efficiently. I will try to pass all of those parts, and I would like to speak about the treatment. With regards to anxiety and psychoeducation, in order to indeed cope up with the anxiety disorders, risk prevention might be used. And when it is about the depression, how can we control this process, and how can we indeed provide coping strategies with the emotions and the ideas, and their social development matters as well. These are the different phases. I would like to skip all of those slides. The aim of the treatment, we should know whether the patient is ready or not, and whether the parent will be affected by that or not. The parent's role in the treatment mattered as well, because the parent might be used as a facilitator as we try to give the psychoeducation. And from time to time we might use the parent as the co-therapist. So we might teach them some techniques like risk prevention. And if this is not the case, sometimes we can use the family as a client. And since this is a family-based problem, we should first of all treat the family, then continue with the kid. I will skip all of those slides. I already defined the SMART goals. The formulation is the most important part of the treatment. And the relationship between the behaviors and the emotions matters, and we might come up with a developmental formulation if it is a severe problem, or you might use some simple formulations, and these are some techniques that we can use, cognitive and behavioral techniques, positive self-talk, anger parameters, cognitive restructuring, activity scheduling. These are the techniques that we use in the depression. These are the problem-solving techniques. From time to time, we might use balloon in order to empty our stress. We use some exposure techniques. Another treatment model, coping cat, which is used for the anxiety problems by candle. You might try it out. Thank you very much. I would like to apologize for speaking so long.